Now we are with Oliver Karanfilski. He is the president of the Macedonian Hematology Association, and he will talk about peripheral T-cell lymphoma in 15 minutes. We are very happy to see you in our country, in Antalya, and this is not the first time, I think, that you are in our country.
No, it's not the first time. I have been here for many meetings. I have many friends among the people from the Turkish Society of Hematology, and always I have been using Turkey as my top choices when it comes to summer vacation also. So I have been here a lot of times.
So nice hearing from you these things. Which kind of hematological diseases are you confronted most in your country?
As in all other countries, most of our work has to do with malignant diseases.
Yes.
I'm not any kind of an expert in peripheral T-cell lymphomas. This is simply answering to a very kind invitation by Professor Teoman Soysal, the president of your association. He chose the topic. He gave me the task to speak on this topic, but it doesn't say in any way that I'm kind of an expert in that field. As a matter of fact, it's a very rare disease compared to other B-cell lymphomas. But we tend to put in our hospital, in our university clinic for hematology in Skopje in Macedonia, mostly the patients with acute leukemias. They're the ones that need continuous hospital support and treatment. And we tend to treat our other, let's say, less aggressive diseases in the daycare unit, such as lymphomas, myelomas, and stuff like that. So it's more or less the universal situation.
Yes, exactly. And the Society of Balkan Hematology is established in 2005. And do you think that we can do it better, that we can make it better, stronger the relationship between the two countries? What is your opinion? What can we do in order to make this relationship much stronger?
We just had a meeting of the representatives of all countries. There are currently 12 countries in the Balkan Association. It has been successful in organizing meetings every year. Every year we also have a meeting of this coordinative body, and we express our ideas, our initiatives at that meeting. And so I think it was a very productive meeting with Professor Soysal today. And I think that we are going to expand our cooperation in terms of maybe providing platforms for unified, let's say, evaluation of patients, so that in perspective, if we decide to fuse the data, to merge them together, it will be possible. We have to take it step by step. We have, as countries, we have experienced of transformations which in other countries are faster, in some are slower. So in medicine, it is also a matter of differences in possibilities for diagnosis, in possibilities for treatment, but the patients are mostly the same. Patients and diseases do not know about borders between countries. So it should be the same way of diagnosis, it should be the same way of treatment. If we manage to merge our data, our patterns of work, we're looking at a territory that is roughly, I spoke about that in my morning presentation, it's a territory of 1.5 million square meters, and it's a population of 140 million people. This is not neglectable by any means. So it is a large population, it has a lot of patients, and it is worthwhile working for a unified approach towards these patients.
So we have to get organized and do things together. And also in one country, the data should always be merged together, and treatment approaches and diagnostic approaches should maybe homogenized together, as you have mentioned.
This is something that has been done, let's say, on a higher level. There is a European Association for Hematology, and this process is called roughly harmonization.
Yes.
So we are trying to reach what those that are better than us can do, and we are trying to go with higher standards than those we have. it is in our profession to ask always for better. Whether it is an effort that will succeed depends on many things. Mostly, as Professor Mutlu Arat accented this morning, a lot of the things we do in hematology and in oncology in general depends on the GDP of the population of the country. And we are different in that sense, but there is nothing bad in wanting to become better.
Yes, you have stated very well. Lastly, I want to ask you, what is the most enthusiastic part from the point of your view of being a hematologist? What is the most excited part of our jobs? Can you comment on this?
It is a very difficult job. I am going to say something about this during my next presentation. Within the next hour, I will have a presentation. Fortunately for me, there is a paper on Medscape. This is a widely used professional platform by medical and oncology professionals. And there is an article saying, are oncology doctors different from others? We have a different task to merge the pessimism of patients when they become aware of having a malignant disease and the optimism of professionals when they become engaged in saving lives, in defying nature, in battling against death. This is a battle that is going both ways. For some patients, it's going on their side. For some patients, it's going the other way, the way we don't want. So it is a very demanding, a very challenging, and a very responsible profession. But we are doing this all of our lives. We are dedicated to it. And of course, the easiest thing is to cure a patient of a non-malignant disease. I always tell my students the best disease we have in hematology is B12 vitamin deficiency. You diagnose it straight, you cure it for 10 days, patients are happy, doctors are happy, everybody's happy. It's not like that with malignant diseases. But you have today's paper. I have said some things over there. I do think that the time when I'm working in hematology are good times for hematologists. We have come through 4, 5 revolutions in treatment. Now, remember, we're dealing with malignant diseases. Malignant diseases inevitably come to a fatal end. We have cured hairy cell leukemia with 1 treatment. We are curing 90+% of patients with chronic myelogenous leukemia. We have come to a point where we cure more than 90% of patients with Hodgkin's lymphoma. We're curing acute promyelocytic leukemias with almost 100%. Those are all malignant diseases. No other oncology professional can have that kind of data behind them. So, in spite of dealing with many difficult diseases, we are happy that we have found a way to defy nature.
Yes, these statements were also in your reportage on the paper. And
paper.
That was why I asked you this question, because I knew that you will answer me with excitement. Do you have anything to add?
I have to express my gratitude and my respect always for the Turkish Society of Hematology. Yeah. It has been for a long time one of the leading societies in the region. We have been appreciating, admiring its activities. We have friends among all the people in the Balkans, but it has been a line, an accent, a characteristic of the Turkish society to be very hospitable to others, especially to those who are less fortunate than them. So I was very glad to accept Professor Soysal's invitation, although it meant a lot of work. I hope I don't disappoint him in my presentation.
Yeah, sure.
And it is always a pleasure to be here, to see friends, to exchange professional views, to make some progress, some initiatives for future cooperation, and I think it will work fine.
Yes, we also are very glad that we are seeing you here and asking you questions and sharing our experiences, that you are sharing your experiences with us. Thank you very much for coming here and answering our questions.
It was a pleasure. Thank you.